All right, so the Omicron wave continues to wreak havoc across the United States, and we just recently hit a pretty ridiculous milestone for the pandemic as the US reported an all-time high 1 million new COVID cases in just a single day, coming out on January 3rd, as many states were dumping their holiday backlog. So again, pretty key important piece of information there that they are dumping their holiday backlog. So you could kind of make the initial argument that this may be an overestimate, but honestly, with the at-home tests that aren't necessarily logged in this same system, and with many people having asymptomatic COVID experiences who might not get tested at all, this actually might be an undercount of the amount of new cases that we are actually seeing. And looking at this on a graph, I mean, it's laughably ridiculous that this is where we are right now, this deep into the pandemic. I mean, we are absolutely blasting through case number records right now. But I've told you guys multiple times on this channel that cases are not necessarily the best metric to be looking at when you're trying to formulate public policy, or if you're trying to gauge how scared you should be, basically. But it does give you a good perspective in terms of how widespread Omicron has actually gotten to. Now, the better metrics that we're going to get to here are hospitalizations and deaths, and even those are pretty up relative to where we were just months ago. But again, case numbers, not the best metric, but it does give you a perspective in terms of how widespread Omicron is. And the fact of the matter is, even if you have a substantially vaccinated population, if something is this widespread and it is basically hitting everyone in the population, I mean, I'm sure you guys have this as well, but just in my personal life, I know like literally almost a dozen people who have gotten COVID over the last week or so. So when you have a variant that is this widespread in a population, then it's pretty likely that it's going to hit every single person, or a large portion of the population that remain to be unvaccinated. And that's obviously a problem, which has led to the current situation with hospitalizations and deaths. And you can see here, we also currently have roughly 110,000 Americans that are in hospital with COVID-19, which is the highest since our massive outbreak that we had back in January of 2021, back in the winter, which was this outbreak. And so that was hospitalizations. We're now talking about deaths. And if you look at the daily new confirmed deaths, this is also up relative to, again, just a couple months ago, or barely a month ago back in November. But it is kind of like in the middle ground between the major waves that we have been seeing. Now, the reason why this line looks like this and this line looks like this is mostly because of vaccines. So this is evidence, first and foremost, that even though the case numbers are significantly up and the deaths are somewhat in the middle here, although they are still at a completely ridiculous number, we're averaging roughly like 1,300 deaths per day right now. But you see that the disconnect between these lines is largely due to the fact that the vaccines are actually working in largely preventing hospitalizations and deaths for people who are vaccinated. So again, just another reminder, go get vaccinated, go get your fucking booster, all of that. I highly recommend them. You are probably not going to be included in the statistics if you actually go out and do that. Now, we can talk about all of these different lines, right? We can talk about the cases, we can talk about the hospitalizations, we can talk about the deaths, but at the end of the day, here in the United States, in the hyper-capitalist hellscape that we live in, the only line that actually matters is this one. And the stock market is chugging along just fine right now. And we've seen, a lot of institutions, whether it's the CDC with their recent guidance that we're going to get to an update here in a second, or whether it's just with politicians like Joe Biden, or even Republican politicians around the country, they basically just given up at this point. I mean, it doesn't even seem like anybody is making real attempts to control the spread of COVID. And it's basically at this point just like, the original ridiculous Trump strategy that he was trying to put in place of just let it spread like wildfire and hopefully it'll burn itself out, I guess. But that's not what's going to end up happening. We're just going to have more COVID variants that are emerging, and this cycle will continue on and on and on unless we actually get this under control. And there's multiple things that you could do about that, but it really just honestly doesn't seem like anybody who is in a position of authority right now, establishment Democrat or Republican, gives a shit about doing anything. So let's just check in with how the wonderful state of Florida is doing, because when I say that it's not just politicians, right, it's also medical professionals like Fauci and the CDC director, Rochelle Walensky, and also this Florida Surgeon General. All of these medical professionals are actually coming out now and just like completely giving up on trying to contain COVID in any way, shape, or form. And I wanted to play you guys this clip because it just gives us a perspective in terms of how like at face value laughable a lot of what they're saying right now is in trying to force people to get back to work. We saw the CDC lower their standards for isolation to try to get people back to work and reopen the economy, etc. So we see where their incentives are and we see where their priorities are, basically. But let's just go ahead and hear from this absolutely ridiculous Florida Surgeon General.
We're going to be working to unwind the sort of testing psychology that our federal leadership has managed to unfortunately get most of the country in over the last 2 years. We need to unwind this testing planning and living one's life around testing. Without it, we're going to be sort of stuck in the same cycle. So, it's really time for people to be living, to make the decisions they want regarding vaccination, to enjoy the fact that many people have natural immunity. We're going to be
Okay, so yeah, that is literally the Florida Surgeon General, okay? And the thing that really stood out to me in this entire clip is as he's saying all of this, he's literally standing in front of a sign that says, "Early treatment saves lives." Now, please explain to me how somebody is supposed to know that they're supposed to go get early treatment, whether or not they even have access to some of these treatments is another question, but how the fuck is somebody supposed to know to go get early treatment if they don't know that they have COVID because you're telling them not to go get tested? I mean, this is just like, it's so ridiculous. Again, it's like reality is just a fucking Onion article come to life, but here's the Florida Surgeon General basically saying we need to unwind this COVID testing psychology, okay? Last time I checked, testing whether or not you have the pandemic that has been spreading for multiple years now, testing whether or not you have COVID is not some like psychological trick that's being played on you. It's actually just like one of the most fundamental aspects of a public health response to a pandemic. But apparently even the Surgeon General in Florida is completely giving up on even, figuring out if we have cases in the first place, which is basically, the pandemic equivalent of like closing your eyes and saying, if we don't look at COVID, then it doesn't really exist, I guess. So again, just completely ridiculous. And he carried on here with some more complete nonsense here. He said, Florida Surgeon General Lepedo says that he's working to unwind the government's COVID testing psychology, saying, quote, "Running on this treadmill of test after test and restriction and vaccine passport and booster and the second booster and the third booster, that's someone's dystopian vision." So again, a lot of that is kind of just hyper sensationalizing what's actually been happening. But on top of that, these are just some basic like how you handle a pandemic. I mean, listen, I know that nobody likes the restrictions. Nobody likes putting on a fucking face mask when you have to go out or you're in a public setting. Nobody likes getting jabbed in the arm to have to get a vaccine. But this is like very basic shit that if you're going to live in a civilized society, especially as a pandemic is spreading like wildfire through the country, you're going to have to adjust your behavior very slightly. But they don't seem to be willing to even do literally anything to control the pandemic at all. Again, condemning the booster shots, condemning the vaccine passports, but especially just condemning the booster shots in the first place. If you wanted us to get the pandemic under control, the first and foremost thing that you should be doing is encouraging people to go get fucking booster shots right now so that we don't have people flooding our hospital systems to the point of collapse, okay? That's one of the most basic things that you could do, and that was just the Florida Surgeon General. So now let's check in with the CDC, which, as I covered on this channel last week, they basically changed their guidance at the behest of corporate America from the 10-day isolation period down to 5 days, and they had no testing requirement before, and they said that they were going to kind of update that and adjust it, and basically the update that we've gotten is that you still are not required to take a test to leave the 5-day isolation period, and they basically just made it as weird and confusing and vague as humanly possible. So please tell me if this sounds coherent to you guys in any way, shape, or form. So from CNN's Caitlin Collins, she said the CDC has updated its isolation guidance. They still don't recommend a rapid test after 5 days, but say if you take one and it's positive, isolated people should continue isolating for 5 more days, and those who leave isolation are urged not to fly on planes or eat in restaurants. I mean, what the fuck is even, what is this guidance here, okay? So you're not supposed to go to fly on planes, you're not supposed to go eat in restaurants, but get back to work. I mean, how the fuck does that square away with anything? Are you saying that if you don't have this extra test that shows that you're negative, or you didn't even take one, that then you can go back to work in a restaurant, but maybe you shouldn't be eating at a restaurant? I mean, it doesn't make sense at all. But they say, again, a rapid test after 5 days, that you're not required to take one, but if you take one, they're just kind of like throwing it out there as like, you can take it, you might not take it, maybe you take a test, I don't know, maybe it'll turn up positive. And then they say that if it turns up positive, then you should also keep isolating for 5 days. So if there's a large chance that a substantial portion of people who would be leaving isolation after the 5-day period, if there's a large chance that some of those people are going to be COVID positive, wouldn't you want all of them to test so that you know who's COVID positive before sending them back out into the world or sending them back to work? I mean, it seems like having having that, maybe even a double negative test would be like the bare minimum. If you want to lower the guidance from 10 days to 5 days, at least have a double negative test to make sure that people aren't shedding the virus and they aren't going out and spreading the virus rampantly. But it appears like they don't even give a shit about that. So they don't have the testing requirement. But if you just so happen to take one, and again, we're still living in a reality right now where we don't have universal free at-home tests. So your options for testing here, as they're telling you that you don't have to test, your options if you do want to go test and you want to get that extension on the isolation period, then your options are either to go and stand in a line or sit in your car in a line at one of these free testing facilities, and you might have to wait for hours in that line, which, believe it or not, plenty of people don't have fucking time to do that in their day-to-day lives. You might have to go wait in one of those lines, or you might have to go searching from pharmacy to pharmacy to pharmacy, and if you manage to find COVID tests, then you're probably going to have to pay out of pocket like $30 for just a couple of them. So it's just a completely ridiculous failure from the top down, from the federal government, from the state governments, like this ridiculous motherfucker down in Florida. It's just a complete failure from top to bottom. We never had enough testing capabilities, and now they're basically at the point where they're saying, we have so many tests that we're testing positive for right now that we're just giving up. We're just giving up on controlling the spread of COVID entirely. It doesn't matter if our hospital system is on the brink of collapse. It doesn't matter how many people are going to have long-haul COVID symptoms. It doesn't matter that we have 1,300 deaths per day. All that matters is that this pretty little line right here continues going up. So that's the state of COVID right now in the United States. It's just an absolute shit show.